starting your timer, and here is your question. Right, so if you have read and understood, considering it communication skills station, kindly begin. Begin, please.
Hello.
Hello.
Hi, I'm Dr. Mo, one of the SHOs working at the surgical department of this hospital. I'm calling for the surgical registrar on call today.
Yes, I'm speaking.
Okay, so doctor, I have to discuss about a patient. This is a 69-year-old lady who had an elective right hemicolectomy 1 day ago for CK tumor with liver biopsy for suspected metastasis. But apparently, she has been. The nurse said that there has been low urine output in the intraluminal catheter. Clinically. So I need your management and advisor. Clinically, she is tachycardic with heart rate of 120 and hypotensive 90 over systolic blood pressure 90 over 60 millimeter mercury, a temperature of 37.5 degrees Celsius. And during postoperatively, we noticed that hemoglobin has dropped from 12 to 10, and the surgery can note say that she received 2 units of blood during the surgery. So we ran a few more tests, which is renal function. It showed acute kidney injury with raised creatinine and urea. Otherwise, her abdomen is soft, and the ECG and chest X-ray are unremarkable. We checked the urinary catheter. It is only a urine output of 10 to 20 ml per hour in the last 8 hours. The catheter is still patent and no blockage. On the intake output chart, she has only received 1.1 liter of normal saline.
Yes, question from the other side.
Okay, so what do you think the cause is?
From all these factors, I think this patient is having AKI, probably acute kidney injury, most probably due to dehydration.
AKI is what? Don't use, please don't use abbreviations. Acute kidney injury.
Yes.
Why do you think so?
Because the kidney function tests show raised creatinine and urea level, and according to intake output chart, this patient has received only 1,100 ml of normal saline over the past 24 hours.
Okay.
And there has been a blood loss during the surgery. It mentioned that she has received 2 units of blood.
All right. So, what are your plans of actions for managing this patient?
For this patient, I'll start flera resuscitation at 30 minutes per kg per hour. And then I will recheck the hemoglobin and check the vital signs again. If it doesn't improve, I will send this patient to HD unit and monitor the vital signs. And I will also call you again to update the patient.
Okay, so do you think that the patient is bleeding?
Apparently, what I found is a hemoglobin drop of 2, but the patient's abdomen is still soft and non-tender. But if the hemoglobin keeps dropping and if there is signs of biliary peritonitis, that there might be bleeding from somewhere. So at that point, I will need to group and saving and get the blood resolved.
Okay, so what are the clinical signs will you see if you think the patient is bleeding?
If the patient is bleeding, she will start to have hypotensive and responsive to fluids with tachycardia and very low urine output.
Mhm. Any clinical signs?
And the patient will also starts to feel drowsy and drowsy, restless, and that become unresponsive.
Okay. So do you think it is an anastomotic leak?
It is one of the it could be, but for the time being, the abdomen is soft, so I will do serial abdominal examination. And if there's signs of peritonitis, I will order abdominal ultrasound to look for any signs of leakage, intra-abdominal collection.
Okay. And do you need me to come back?
At the moment, it is not necessary, but I will update you accordingly about the patient's conditions.
Okay, so when you will transfer this patient to HDU?
To HDU, if the patient doesn't respond to the fluid challenge.
Okay, how many fluid challenge you will give?
I will do twice.
Okay. All right. So is there anything else you would like to update me for this patient?
Not at the moment, sir. Is there anything that I can do for this patient?
Is there any blood test you would like to send for this patient? Any other blood tests?
I will be doing regular blood tests such as full blood count UNC, and I repeat the kidney function test again as well to see if there is improvement after the fluid challenge.
Okay. So what about the TLC and CRP? Is it mentioned?
Yes, they will be included within the routine blood investigation list. Yeah.
Okay.
Okay, if the HDU is full, then who are you going to speak to?
If the HDU is full, I will stick to the blood manager and mention that this is urgent case and ask for facilitation of discharge or repatriation of the patient.
What do you think might be the cause of the shock in this patient?
In this patient, the shock it could be hypovolemic shock as well as septicemic shock. We still need to look for clinical signs that will be coming in along with the blood results. Yeah, but you did mention that patient's vitals are stable. Yes, at the moment it is quite stable. So cannot be septicemia. Okay, who's the consultant of this case? It is Dr. Mann. All right. How would you conclude this station? What would you do? Sorry? How would you end the station? What would be the concluding sentences? Let me summarize this case. If you don't have anything to order, so this for this patient with postoperative day with Oliguria, I will do the fluid challenge. If there is no improvement or deteriorating, I will inform you again. So. Okay, good. Thank you. Thank you very much. Bell is gone and we have ended. So can you give the feedback to the doctor first, to the candidate, or should I give? You started off very well. It was very clear. You knew how to report your patient to the consultant. That you started off very well and you did very well. But in between, like when the
consultant asks you, do you think it's an ostomotic leak? You only mentioned that abdomen is soft. You did not mention, because abdomen is soft, okay, and you said if you'll feel that there is leak, you'll do the abdominal ultrasound. But then you have to mention 2-3 other things as well. You can say, okay, chest X-ray is clear, so that means there's no gas under the diaphragm, so there's no sign of proliferation or any, there's no sign of any other thing. So, and also the vitals are stable. So 2-3 things if you'll add, even though there has been a drop in hemoglobin and there is little temperature rise, but still patient is stable. So if you'll mention 2-3 other things, it will give you an extra mark. That you understand. And the dose for the fluid challenge, you have to understand and you have to tell accordingly. Like you have to give a precise management plan. When the consultant asks you, how do you plan to manage the patient? Then you have to write 3-4 at least points that you will carry out one after the other in order to manage this patient. These 2-3 things, if you'll work on these, your station will become excellent. It's already good, but then we want to improve. So this is my feedback for you for today. Thank you, both of you.
Thank you. Thank you very much.